Good day, everyone. My name is Gerald Ababa Bisara from BSN 212K, and today I'll perform the perennial flashing return demonstration. Perennial flashing is a hygienic procedure that involves cleaning the perineum and genitalia. Washing these areas properly is very important to prevent infections, odors, and irritations. Perennial flashing is mostly needed for those who are bedridden, those who deal with incontinence, and those who have an indwelling catheter. So prior to the procedure, I have already prepared the necessary equipment needed, which includes the bedpan, the kidney basin, the sterile forceps, the 7 pieces dry cotton balls, the 7 pieces of cotton balls soaked in a cleansing solution, an antiseptic spray, a pitcher with warm water, and a new set of clean underwear, and lastly, the clean gloves. Now, I have already performed hand washing. Let's go and meet our client. Hi, good morning. My name is Gerald Ababa Bisara from BSN 212K, your student nurse for today. And for your verification, can I have your wristband, please? Can you please state me your full name? Okay, Scarlett Lucera. How about your birthday? April 4, 1991. Okay, thank you so much. What do you want me to call you, ma'am? Okay, Scarlett. Scarlett, what language or dialect do you prefer? English. Scarlett, for today we will be doing the perennial flashing, where in this procedure I will be washing your perennial area, or particularly your genitals, with warm water and a cleansing solution to remove perennial secretions and odor and to prevent infections and contaminations, which would also promote your comfort. Later, I will be exposing your perennial area and touching some parts of your genitals. Would that be all right? Okay, thank you so much. So now, let us lock the door or close the door for our patient's privacy and adjust the room lighting and room temperature for our patient's comfort. Okay, ma'am. Are you comfortable with the temperature, ma'am? Okay, thank you so much. Now, we must position the patient on a dorsal recum bend. This is done to provide good visualization of the area to be cleansed and also for our patient's comfort. Can you please follow me, ma'am? Okay, thank you so much. Now, drapes the patient, exposing only the parts to be cleansed. Since that my patient has already draped herself with a blanket, let us now ask the permission to expose her genitals. Ma'am, is it okay with you if I could expose your perineal area, specifically your genitals? Would that be all right? Okay. Remember that we are only exposing the area that we will be cleaning to avoid making the patients feel embarrassed and to avoid chills. All right, ma'am. Now I will gonna place the bed pan underneath your buttocks first to avoid the bed to be soiled. Would that be all right? Thank you. Now we will first glove our hand. Now we will flush the perineal area with warm water while inspecting the perineum. We must note any forms of inflation, swelling, excessive discharge, secretions from the orifices, and presence of odors. Note that we have to use warm water to avoid chills and dissolve any blood clots. Flush while inspecting. Now, Use the cotton ball soak in a cleansing solution using our pickup forceps to maintain the sterility. So this is the forceps and the solution with alcohol. And start cleansing the external genitalia starting from the midline of the symphysis pubis down to the anus. Remember that never retrace a stroke to prevent contaminating the cleansed area, and after doing this, this will be we will be discarding the cotton. So we will discard the cotton and our kidney basin. Discard. Now, with our second cotton ball, we will clean the labia majora by starting from the mons pubis and figure 7 by way of the labia majora towards the anus and discard. Do the same procedure on the opposite side of the next cotton ball. Next, we will be cleansing starting from the mons pubis, but this time in figure of 7 by way of the labia minora towards the anus and discard. Do the same procedure on the opposite side with our next cotton ball. With another cotton ball, we will be cleaning the groin, starting from the groin going up the thigh area. Use the other side of the same cotton ball for the near groin. Then discard. Then discard. Since we are done cleansing, we will now flush the perineum thoroughly with sterile warm water. Now in drying, I will be using dry cotton balls to be used in the perineum with the same strokes as when we cleanse using the soaked cotton balls. This step is necessary since moisture supports the growth of microorganisms. Now with another forceps and another dry cotton balls. Now we will continue on drying the area starting with the midline of the symphysis of pubis down to the anus. Same procedure as earlier. Okay, discard. Now, from the mons pubis and figure 7 by way of labia majora towards the anus. Discard and repeat on the other side using different cotton ball. Discard. Next is from the mons pubis and figure 7 by way of labia minora towards the anus. Discard and repeat on the other side using different cotton swab or cotton ball. So with another cotton ball, dry the groin area up the thigh and use other side of the cotton to clean the near groin. All right. So since that we are done with cleansing and drying, now ma'am, can you please lift your buttocks for a second, or can you please slide side lying position so that I can dry your buttocks? Thank you so much. Okay. So if necessary, take one cotton ball and clean one side of the buttocks, then clean the other side of the buttocks, dry both buttocks or dry both buttocks. Discord. Okay. All right, ma'am, we are done with the procedure. You may now go back on your previous position. Okay. Okay. Are you comfort? Do you feel any discomfort? Okay, none. Thank you so much. Now use an antiseptic spray to promote healing. After that, after using septic spray, we should put the perennial pad with an up-down motion as needed to prevent contamination of the vagina and urethral area from the anal area. If deemed necessary, let the patient wear an underwear along with the perennial pad. Ma'am, do you want to wear underwear? No? Okay. We are now done with the procedure, ma'am. How do you feel? Great. Okay. All right. Thank you so much, ma'am. This is it for today, and I will now leave my patient so that she can continue her resting. But before that, we should go. We should drape our patients because the area are exposed, so we need to cover it. Now, since we are done with the procedure, we must do an aftercare on the materials used and perform another hand washing. So let's throw this contaminated cotton balls and the water of the bed pad and set aside all the materials and disinfect all the equipments that we use. Now, lastly, record the treatment done to the patient and any observable discharges or unusual findings. This is important for documentation purposes and means of communication to other healthcare providers. Now let's throw our gloves and throw it into our proper receptacle. Now we can go to our station and document the findings. That's the end of my return demonstration. Thank you for watching.